You need a presenter, please. Come on, guys. You're going for the exam, not me. I need a volunteer to present a task. It's just a friendly discussion. There's no, nothing to be scared about, or nothing to feel shy about. Make um, an attempt, present it. Even if it is a mistake, I'm here to correct your mistake so that you'll be learning from the mistake. Whereas if you don't attempt, then you may not know what's your mistake, and you might do the same mistake in the exam. In the exam, nobody will come and correct you. Otherwise, I might have to call you by names. Billy, are you ready for a presentation?
I'll try, ma'am. I'm not.
Yeah. Good.
I have not finished studying. My revisions are not yet complete.
That's
So
okay, but try it.
I'll try.
Right.
Yeah.
Yeah. So
Okay.
I will focus you the task and I will put my timer on. So at the 10 minutes, you will hear a bell, and after that, you'll be starting presenting. Okay?
Yeah.
Lovely. Right. So there are two slides. Okay. So you will tell me when to scroll. Okay.
Yeah, ma'am.
Right. Your time starts now.
One problem is, sorry.
Sorry?
No, ma'am. I'm from my mobile, so it was not. I was not able to read. Okay, now I'm reading.
Yeah.
I
Okay.
enlarged it.
That's okay. Ready for the next slide?
Yes, ma'am.
Yeah. You want to go back to the previous slide?
Yes, ma'am. Ma'am, can I see that picture again?
Yeah.
That photo that.
Right. Your time is up.
Yeah. Okay.
You're starting
Uh,
your 10 minutes now.
okay. Hello, I'm Dr. Amli, one of the candidate for exam. I'm ready for the discussion.
Right. So could you please summarize this task?
Yeah. I was doing laparoscopic sterilization, and I have gone through the task, and I and my ST1 were doing laparoscopic sterilization, and while entering, I could notice that my ST1 is not holding the trocar. I was holding the trocar instead of manipulator, and when I just noticed it, I could see there is perforation and some blood inside the at the in the POD also I could notice.
Right. So how do you manage this scenario?
Okay, so I would ask to stop the procedure then, and I will inform my anesthetist and my team members, my nurses also, that a complication has occurred now, and we may need extension of the anesthesia, as well as some other procedure may be added, so instruments will be needed. And I will immediately remove that trocar from there, and I'll check what is the how much big is the perforation, whether it is bleeding, or is there any other injuries caused by it. I'll observe the whole vicinity around also, so that whether there is damage to any other organs also, like any bowel involvement, any bleeding from any other sides also present. And um, if there is bleeding, I will try to check that bleeding points. And if it is a large area of perforation, I would like to repair that area. Then, as it is a complication, I have to document it, debrief it to the patient, and the patient should be observed, and risk management team, incident report and risk management team also should be involved. She should be observed for any further bleeding. Her vitals should be monitored, and yeah, she should be given antibiotic prophylaxis also.
Anything else?
Mm. I'm sorry, madam, I'm not sure.
So how are you going to deal with this trainee?
Yeah, okay. Trainee should be there should be a discussion with the trainee regarding she should be given more regarding what happened, and she should be given more training. There should be a learning session in which we should be non-judgmental, and we should not be blaming her. Instead, we should try to teach her and train her more, so that she will not repeat this mistake again.
Anything else you would like to add?
That should be written in her portfolio, and some reflective study, something is there. I forgot actually.
Okay, right. So you still have 5.5 minutes. If you want to speak anything, you can speak.
Sorry, ma'am, I'm not prepared.
That's okay. Right. Thanks for attempting, Ambali. Right.
Yeah.
I can see that most of the things that you tend to speak from your experience, right? Like you do this say same things in your hospital or in your case. You try to talk that, but in the Royal College, we expect a little more than this. Okay.
Okay.
So basically, first of all, when you introduce, my dear friends, all of you have to understand this point that when you speak to the examiner, don't speak as I am Dr. So and so. Yeah. So please say that I am so and so. Okay. So when you speak to the role player, then you can say, okay, I'm hello, Lisa, or whatever her name is. My name is Dr. So and so, and I'm one of the doctors in the clinic today. May I check your name and age, and such things is okay. But remember, when you speak to your examiner or a teaching task to your colleague, please introduce yourself as by your first name. Okay. So, like for example, if my name is Lisa John, then I would say, hi, my name is Lisa. And, that should be when you talk to your junior colleague in a teaching session, or when you talk to the examiner in the structured discussion, say, I'm Lisa, I'm one of the candidates for the exam today. Okay. Don't say, I'm Dr. Lisa John, one of the candidates for the exam. Okay. So please don't do that. Very important. They notice that, and that should not hamper your scoring. Yeah.
Okay.
Second thing is, this is a crisis. There's something has happened. So always call for help. That should be number one. Okay, I'm not sure how many of you are aware of this protocol. So whenever there's an advertent incident, whenever there's a crisis, whenever there's a PPH, whenever there's an eclamptic fit, whenever there's always the first and the foremost thing that you will do is call for help. Yeah, that is what is this is how the system works here. It is not that it's never a one-man show. It is always a teamwork. You have to call for the other team members. You have to communicate with them. That is very, very important. It is just not merely doing the clinical things. It is communication, which is more important. Documentation, which is more important. And teamwork, which is, it's always looked as a teamwork and not as an individual work. So remember, you might be an individual practitioner in your own place, in your hospital, in your clinics, in whatever stuff, in whichever setup you're working. But when it comes to working here, when you approach the Royal College exam, it's always a teamwork. You might be the team leader, but still you have to communicate with all the team members of the uh, of of that particular scenario. Okay. So that is very important that you communicate appropriately. Okay. The first thing that you will, whenever it is SBAR, please understand this is situation, background, assessment, and recommendation. So what's the situation? Hang on, this is a call bill for me. So remember, guys, you have to tell what is the situation. The situation is this: uterine perforation occurred because of the trocar perforating the uterus. So first of all, we need to confirm the size, the size, and the number of the uterine perforation. Okay. Sometimes it can go deeper, and it could have involved the tract, urinary tract, or even the bowel or the vessels. And it sometimes it might there could be a collection of hematoma on the broad ligament. So that is very, very important. Communicate with the team, call for help, inform the anesthetist that that could be a prolongation of the procedure, check the patient's the observations. Okay, I would no here again it's a spelling mistake. It's not vital signs, so we call it as observations. So my typist has made a mistake here. We call it as observations. We never call as vital signs. Okay. So again, continue the monitoring of the observations. Call the consultant, inform the theatre team, call for help, and other specialities. So suppose if there's if it involves the other organs like the bladder, the bowel, we might have to call the specialists, the bladder surgeons, the urogynecologist, or to the general surgeons or the vascular surgeons, depending upon that. So always the instruments for exploration of the further exploratory laparotomy have to be performed. So you might need further instruments for that. So involve the scrub team, involve the scrub nurse, tell her that, see that talk to the anesthetist. Sometimes it might involve blood transfusion. So see that blood is being needed. Maybe you just call the anesthetist to inform the blood bank. They will do that. So make sure that your patient is not a Jehovah's Witness. So that you would have already done at the time of consulting. But again, just make sure on the table once that this patient does not have any objection towards blood transfusion. Sometimes, these elective procedures, we may not give them any antibiotic, the elective laparoscopies, but because of the perforation, we might have to give them antibiotic. So tell the anesthetist to give a course of IV antibiotic, a comoxiclav or a kefenmet, cefuroxime metronidazole, which we generally give, or sometimes we give a comoxiclav IV antibiotic. So that, just tell the anesthetist to give. And of course, for the exam sake, you should say that after you confirm the drug allergy. So if the patient is under spinal anesthesia, where she's awake, inform the patient, but say that in a non-frightening way. Remember, Ambali, you made a mistake that you say that you will go and remove the trocar. That's a mistake. Okay, if you say that to the exam, that they will fail you in the patient safety domain. Okay, so don't remove the trocar without the consultant or the senior team members being present in the theater. Am I clear with this?
Okay. Yeah, ma'am.
So trocar should not be removed at this point, as this could increase the perforation and it could lead further bleeding, especially if if it involves the major blood vessels. So remember to make sure that the consultant and senior team members are already present in the theater before you remove the trocar. So remove the trocar gently under vision. If small and there's no bleeding, then you can just continue with the observation. There's no need for any further intervention. But if bleeding is present and the patient is stable, okay, we can do the repair through a laparotomy. But if the patient is not stable, then we have to do a laparotomy immediately, and ask then the anesthetist may convert the spinal into a GE. Okay. After you've done the repair, you can continue with the sterilization of the patient is being stable and repair. Okay, so confirm all the instruments, swabs, and sharps counts are correct. And always, make sure that there's an indwelling catheter, give her a course of antibiotics. So that's your clinical part. When you come to the governance part, so make sure that the ST1 is being competent enough to assist you in this procedure. So always everything has to be properly documented, and a copy of that has to be present in the patient's file. Duty of candor, that's very, very important. Apologize to her and explain why this has happened. And if she's not happy and she wants to complain, she can apply later, to the pulse. It's not pulse, it's pulse. Sorry, my typist has made a mistake in this. So she can complain through PALS. PALS is the Patient Advisory Liaison Services. Okay. So always a DAT, that's an incident report, should be created. And post-operatively, the patient has to be in the high dependency unit. You will monitor the observations, the input, output. Okay. So all that has to be done. So monitor the observations. Input, output, and then analgesia, and also BT risk assessment. And if there's any abdominal distension, make sure that she doesn't develop any paralytic ileus, everything. If at all, if she then do a set of observations, do a set of bloods on her, including FPCs, CRP, use an ECL, FTs, and coags, and then send for a CT of the pelvis if necessary. Okay. So the post-operative plan should be clearly in place during her post-operative stay. And always at the time of discharge, do an electronic discharge and notify the GP. Okay, give the red flag signs at the time of discharge in case she develops fever, she develops vomiting, so she has to immediately come back. Okay, and also effective contraception should be followed till the next period, even if you are sterilized her. Okay, because the failure rate of sterilization, as you know, is 1 in 200. In case that she conceives also, it could become a high-risk pregnancy, and that could be a ectopic pregnancy. Okay, so when you come to the trainee, you should talk to the trainee in a non-blaming approach. Okay, that's very important, in a non-blaming approach. And it's one of the rare complications. It's a good point that you have to discuss about how, first the good things, then again, you should come where he made the mistake. So how things went wrong. So trocar should be selected either by himself or the nurse who gave to him. So why this instrument was used? Was there a miscommunication? So what did the ST1 have adequate knowledge about the usage of trocar and the manipulator? Was there a miscommunication between the scrub nurse and the ST1 or even if there's miscommunication, the ST1 could have as well asked you. You are the senior, okay? He could have asked well before he started using the instrument. So find out why there was a miscommunication. Okay, that is very, very important. And this is how we learn from difficult situations. So do a reflective practice, do a Gibbs cycle, do a reflective practice. So this is going to be a definitely DATEX, that's an incident reporting. So that will be investigated. And further, the risk team will tell some learning modules. So he will be communicated to the educational supervisor. The education supervisor will ask the ST trainee to do a learnings, do some learning modules and do a reflective practice in the e-portfolio. So try to offer him support as well. So say that we learn from difficult situation. This is important for becoming a, any doctor. So it is all the, everybody undergoes this during the training process. So all that you have to talk to that. Respect the patient decision. Suppose if she wants to comply, refer her to the path. That is very, very important. So see that you remember to tell all these things during your presentation. That is very important. It is just not telling about trocar and this thing. It's all the clinical governance. Okay. So that is why I separately conducted clinical governance workshop just to say, because candidates will be good, especially overseas candidates, you'll be good in your clinical, how you deal with the clinical scenario. But candidates fail because they don't have exposure about the clinical governance. So clinical governance is very, very important, equally important as of your clinical aspects in your case presentations. All right. That's very important. Any questions at all as far as this task is
Yeah,
concerned?
yeah. Yes, ma'am. You told even after sterilization, she needs some contraception, something like that.
For
I
the
could
first,
not
yeah, for
get
the first month. For the first month.
first month only. Okay, okay.
For the first month. That is still she get an next period. Right.
Okay.
So any other doubts? Are we good to go for the next one? Right. Um, I want to give you a scenario wherein you'll be dealing with an angry patient. You want to do that scenario? Anyone of you want to do the scenario for an angry patient? Anyone wants to do angry patient scenario? I think everybody's thorough, so don't want to do. Anyone wants to do angry patient scenario? Nobody wants to do? That's okay.
What can I do, ma'am?
You want to do?
Yes.
Okay. Okay. Hang on a second. I'm just going to focus those slides for you, my lovely. Okay. Yeah. Now, hang on.
Still, the
You want?
screen doesn't.
Sorry?
Nothing going. Nothing on the screen.
Yeah, yeah, I'm focusing. No problem. Okay. Right. Can you see this lane?
Yes.
Okay. Take 2 minutes. Are you ready for the 2 minutes, Noah?
Yes, I will do the 2 minutes. Yes.
Yeah, okay. I will start you 2 minutes now. Timer?
Okay.
Ready for
Hello, I'm
timer?
Dr. No.
Yeah.
Yes, ready. Hello, I'm Dr. No, one of the doctors in the gynae ward today. Is this Mr. Thompson?
Yes.
How do you want me to call you?
You can call me Tom.
Okay, Tom, I'm sorry I have to meet you in these circumstances. How are you now?
Well, I'm just devastated completely. What's happening to Emma? I really don't understand. What is the problem with her? She just went for a termination of a pregnancy, and now people are saying that she's in the ICU. What's just happening?
Yes, I can understand that you are anxious about her. And I'm here to answer all your questions and to address all your concerns. Um, okay, so can I ask you first some questions to be in a better place to answer all your concerns?
First, tell me how is Emma, and when can I see her?
Emma, yes, Emma now in the ICU. She is improving. Her her investigations are getting better, and she is getting better. And soon she will recover, and you can meet her and talk to her.
Okay.
So can I ask you some questions?
Yes.
So, would you tell me more why she went for this surgical termination?
Well, actually, it is an unplanned pregnancy, and we still are in the university. We are at the final year of our course, so we don't want to have this pregnancy. That's the reason that we decided to go for a termination because Emma's got her exam in the next 2 months.
Mhm. Okay, and she chose the surgical as a fast way, or
Yeah,
why she
she
chose
want
that?
to do this as a fast way so that she can return home the same day and then concentrate on her studies.
Mhm. Okay, okay, and will you take any birth spacing method?
Well, I told you it was just an incidental thing which happened and it was an unplanned pregnancy. But Emma was in plans to take contraception at least for the next 2 months till we complete their exams.
Okay, okay, and was there any pregnancy before?
No,
Okay, yeah, and did Emma have any surgery before?
not that I'm aware of.
Okay, was she getting any medication for a long time?
No, I don't think so.
Okay, and was she a smoker or taking alcohol?
No, no, not that I'm aware of.
Was there any family history for her in her
Mm,
family?
I don't think so. She's not told me anything.
Okay, and do you know if she had experienced any blood clot before?
Not that I'm aware.
Okay, okay. Thank you, Tom, for this information. Is there anything else you want to add?
I don't want to say anything more than that.
Okay. So for Emma, okay, from the notes I have seen that she's now in the ICU because of this termination of
Were
the
you the
pregnancy.
doctor who operated? Were you the doctor who operated on her?
I'm not the one who operate by myself, but we are here as a team. So I have read the notes, and I'm here to answer your questions so that you will not stay
Is
more
the doctor who
waiting for
operated Emma,
another doctor.
is the doctor who operated Emma is competent to do the job or not?
Uh, yes, it is not allowed to any doctor who is not competent to enter the theater. This is a regulation by the NHS. So all the doctors who enter the theater are competent.
But why this mistake has happened and why, see, my Emma is suffering now?
Yes, because this was a surgery, and there is no surgery without any complications at all. There is still some risk for complications that may happen. I'm sorry that happened to Emma. That there was a bowel injury occurred during her termination. And that's why to keep an eye on her and on her bowel and how this will progress, we shifted her to the ICU. Until now, she is going good and she is improving by the time.
Well, how long do you
Are you
think?
familiar?
How long do you think that she has to be in the ICU?
We will keep her in the ICU until she is settled and her bowel movement has been regained again, and she can eat and drink.
I think there's definitely
Okay.
something wrong with you guys. You have not really taken care of Emma, and that's why she's landed up in the ICU now. I'm just very upset about this. I'm going to make a complaint against you guys.
Okay. Already we have made the incident report about this, and the risk management team have been formed to check for Emma and what happened with her. And when the investigations will be done, I will be very clear and transparent with you to tell you about what the result are.
No, I don't believe you guys. I want to make a complaint myself.
Okay, we will support you in this. We have here a pulse office that I can tell you where is it, and you can go for them and make the complaint.
When can I see Emma?
Okay, I will liaise with the ICU so that as soon as possible that you can go for her, I will tell you about. Okay.
Okay.
So do you have any question? Any?
No, nothing at the moment.
Okay, thank you.
Thank you. Thank you, Noah. Sorry for making your life hard.
No.
All right. Yeah. So,
Yeah.
yeah, this is more of uh, your communication, your the situational awareness, and how you deal with a patient, an angry patient or an angry partner. So you might expect one of the tasks, like for example, just a partner who's angry because the his partner, the lady went for a surgical termination and she got a bowel injury and landed up at the ICU. Sometimes there could be a lady who had a again, this is one of the proper recall task. Another important recall task could be like a patient who had an urinary embolization, and then she went home and she came back with pain and fever and sepsis, and then she was admitted and then they did a hysterectomy for her. Okay, so in that case, you'll have to tell about further options like IVF and everything. The third could be an angry mother because her teenage daughter was prescribed contraception by the doctor. Okay, so these are certain things that you guys can expect for this exam. So you should be able to do. First of all, so here I've clearly given that he is Mr. Thompson, partner of Emma. So you should make sure that he's the partner of Emma and he's not somebody else. So that's the patient safety. Okay. So, hello, my name is Dr. So and so. I'm one of the doctors in the gynae clinic. Am I speaking to Mr. Thompson? And you the partner of Miss Emma? So that should be your opening. Okay.
Okay.
Here, generally the exam, they indicate that here I've given that Thompson has got the legal rights to talk about Emma. Okay. Sometimes they may not give it. Okay. So you have to make sure that because it's patient confidentiality and they're not supposed to talk about the patient to another person, even if it's a partner. Okay.
Yes. Okay.
Here I've given very clearly that the Thompson has got legal rights to talk about Emma, but sometimes if they don't give, then you have to make sure. Is that okay if I talk to you about her? Then he will say yes. I've got legal rights that you can talk to me about my partner. Okay. So if you don't ask,
Okay.
then they will fail you in patient safety. Okay. Very important.
Okay.
Remember, my friends, allergy. Here also, Noha, you didn't ask about allergy. You asked about smoking, alcohol, and stuff, but you forgot about allergy. This is a very, very important patient safety. Never forget allergy. Allergy is important that you have to ask in all the tasks, all the structured discussions, and all the simulated patient task. Okay?
Yes, yes, even if not the same person. Because I thought he is a
No.
partner, so he will
So
not
you
know
can
about this.
you are talking about you are talking about smoking, you are talking about operations. You need to talk about allergy also.
Okay.
Never forget that. It might sound a bit weird, but for the exam's sake, you need to score for the exam, isn't it? So you have to ask.
Yes,
Right.
okay.
So first of all, when